Hello, welcome to my TED Talk. Today, my audience consists of Laurel and Brooke. Thanks for being here today, guys. So, today I'm going to talk about diabetes. So, diabetes is when you have high levels of glucose in your blood. There's two types. There's type 1 and type 2. Type 1 is usually when people are born with it because they stop producing insulin, and type 2 is really insulin resistant. So at one point they did produce insulin, maybe don't produce enough now, or there's some kind of problem in their body where they're not using the insulin properly. Symptoms of diabetes, like at the beginning, include frequent urination, increase in thirst, dry mouth. You can get itchy or dry skin. There's sometimes an increase in appetite, which also is accompanied by an unexpected weight loss. And then some people will also experience yeast infections. So the way to treat diabetes, first you obviously have to go to a doctor, and you'll get your blood sugar tested and they'll diagnose you. Then they will, for type 1, because you don't produce insulin, you have to administer insulin yourself. So usually there's three types of ways. There's one where you can just get insulin in a syringe, and that's how you do that. There's also a discreet way, which people prefer nowadays, and it's like pre-packaged in a pen, and you just attach like a needle to it. And then there's also insulin pumps, which just depend on people. That's more, it is attached to you and stuff. For type 2, it usually starts off with medication. So a really good one that everybody starts off with is metformin, and the way that is used to help treat diabetes is that it will increase sensitivity to insulin, and then also it'll decrease the amount of glucose that your liver releases. That way you can maintain a good, healthy level of sugar in your blood. Some problems that occur with diabetes if it's untreated, and if it goes untreated for a while, are that because there's so much sugar in your bloodstream, your vessels tend to become kind of leaky. So the first problems usually will be like kidneys and eyes, because they have the smallest vessels. So usually people can experience some kind of like blurred vision, or they can even go as far as needing kind of retina surgery and stuff like that. And then another one that also that affects circulation, so that will sometimes affect the extremities. A lot of people will have numbness or tingling and stuff like that. If untreated for a while, a lot of that can lead to neurological damages and stuff. But usually, if you're taking good care, then you can maintain a good, healthy, normal lifestyle. And you just gotta keep your levels at a normal range, which is usually around 70 to 120. And so basically I just wanted to talk about how important it is to live a healthy lifestyle. And even though diabetes is a big thing nowadays, it's very popular amongst us, there's a lot of ways you can take care of yourself and still live a normal and healthy lifestyle and avoid all those problems that come with it. And that's basically it. So I just wanted to thank you guys for coming and listening.